Copenhagen Polio 1952 Lesson learned by Group 1A, Nur Fariha Nadia. Copenhagen today, the capital and the most populous city of Denmark, a unique city known for being the happiest city in the world, but entangled in a tragic story. Copenhagen Polio 1952, an unprecedented outbreak of polio, opened the eyes of the community, bringing up the variety of lessons. But before going deeper into the topic, let's learn about poliomyelitis. Poliomyelitis, more commonly known as polio, is a highly infectious viral disease that is caused by the poliovirus, especially among children below 5. Poliovirus comes in 3 serotypes, which are poliovirus 1, poliovirus 2, and poliovirus 3. It can spread from person to person through fecal-oral routes and is able to infect the spinal cord, which causes paralysis. Usually, transmission is through contaminated food. The incubation period of poliovirus is 3 to 6 days.
Sophie, can we taste your food?
It looks tempting.
Sure, Jenna Fari. Here, use my spoon.
The next 3 days.
Doctor, I have fever, sore throat, headaches, lethargy and vomit.
Me too, doctor.
Jaina, Ferry, eventually both of you have non-paralytic polio, also called abortive polio. Other symptoms include meningitis. Gladly, both of you are free from meningitis. There is no cure for polio, but worry not, we will symptomatically treat you.
Doctor, I'm so sad. I have deformed limbs, especially on hips, ankles and feet. Sometimes I have sudden paralysis, but it's just temporary. Also, I notice I have loss of reflexes. Help me, doctor.
Sorry, Sophie. Your symptoms are categorized as paralytic polio. It's a rare case. Only 1% of polio cases can develop into paralytic polio. Paralytic polio can lead to paralysis in spinal cord, causing spinal polio or bulbar polio if paralysis occurs in the brainstem. It also can paralyze both, causing bulbospinal polio. Other symptoms may be severe spasms and muscle pain, loose and floppy lips, sometimes on just one side of the body. 2 weeks later.
Hi Sophie, how have you been? I'm recovering, but I'm experiencing some post-polio syndrome. I had continuing muscle and joint weaknesses, muscle pain that got worse, become easily exhausted, and doctor said I had muscle wasting, also called muscle atrophy.
Hi, Fari. I'm fine now. But my post-polio syndrome are trouble breathing and swallowing, sleep apnea, low tolerance of cold temperatures, new onset of weakness in previously uninvolved muscles, depression, and trouble with concentration and memory. Let's just hope that we will not get infected again by polio in future.
The first major documented polio outbreak in the United States happened in June of 1894, when 18 people died, along with 132 cases of permanent paralysis. Back then, we didn't know that this outbreak could lead to epidemic. The effective treatment and the prevention methods are still lacking until the Copenhagen polio epidemic that happened at Black Dam Hospital in 1952. It was the worst polio epidemic that the world had ever seen.
In early Copenhagen polio epidemic, negative pressure ventilators were used to assist and control ventilation of the patients.
Huh? How do negative pressure ventilations work?
Normally, air is drawn into the lungs by negative pressure due to the vacuum space created by diaphragm and chest muscle contraction. Outside the operating room, negative pressure ventilators such as Bladem's iron lung were the sole means of artificial respiration.
Dr. Ibsen, one iron lung is not enough to treat patients. Iron lung is big, heavy, and expensive. It took too much space and it is impossible to supply adequate iron lungs for all patients. Patients are getting out of hands. What should we do now?
Oh my, this is worrying. We need to recruit medical and dental students to power manual ventilators. Convert student classroom into ICU. Ask them to rotate a 6-hour shift and make sure ventilation is done only when the patient shows appearances of running eyes.
Dr. Ibsen recommended immediate manual ventilation via a tracheostomy and application of positive pressure ventilation. Machines are replaced with back squeezing students. Ibsen's idea was to blow air directly into the lungs to make them expand and then allow the body to passively relax and exhale. Patients are assisted with ventilators only when patients show physical appearance of dyspnea.
Doctor, people still die even when on positive pressure ventilation.
What? Give me the details of autopsy result now.
Autopsy result shows bicarbonate level in the serum far above the normal level, causing alkalosis. Dr. Ibsen is curious. He studied the causes. He soon recognized that the high blood bicarbonate levels were caused by severe carbon dioxide retention, meaning the manual pump might cause hyperventilation, fast breathing that leads to alkalosis. From this discovery, he invented mechanical ventilators operating by positive pressure with flow meters being set to 5 to 10 liters per minute to prevent hyperventilation.
Dr. Ibsen, it's working well. You did it.
Yeah, it not only helps polio patients to survive, but it's also proven to improve survival for once hopeless conditions such as shock, drug overdose, and cardiac arrest. This is mad genius, doctor.
Dr. Ibsen's idea gave a ray of hope to the community. The mortality rate decreased from 90 to 30, also able to save 120 people. Eventually,
Doctor, help! There's a patient with respiratory failure.
Doctor, the tracheostomy, I think it's broken. What should I do?
Dr. Ibsen realized medical students must be pleased with a doctor and nurses that are experts in respiratory failure and mechanical ventilation for easier care of respiratory problem patients. This event led to the invention of ICU in all hospitals
All over the world.
Poliomyelitis become a threat to public.
Worrying.
Devastating.
disturbing.
Thus, scientists developed vaccines to stop outbreaks and act as preventive measures. In 1953, Dr. Jonas Salk succeeded to invent inactivated polio vaccine.
I finally found an effective and safe vaccine. My vaccine is produced from a wild-type poliovirus strains of each serotype that have been activated and killed with formalin. Now, people worldwide can be injected with this vaccine to get rid of poliomyelitis.
God bless you, doctor. Oh, finally! Thank God!
Inoculation campaign began. Later in 1961, oral polio vaccine was developed by Dr. Albert Sabin.
Are you scared of needles? No worry, bestie. I invented a polio vaccine that can be administered orally. It can produce antibodies in blood to all three types of poliovirus, unlike inactivated polio vaccine that only maintains immunity to type 2 poliovirus.
This is great! Ooh, I like!
In 1988, the World Health Assembly directed the eradication of polio from the world, Malaysia to action by creating the National Immunization Program. This results in a lower percentage of poliomyelitis cases, over 99%, but few countries have not yet succeeded in stopping the endemic.
Travelers cannot enter Malaysia. We should close the borders.
Close the borders! Close the borders!
Finally, in 2002, the WHO European region was declared polio-free, including in Copenhagen. Every cloud has a silver lining. Indeed, many improvements and inventions were made that are still used until this day. First lesson learned from this epidemic is the inventions of the modern specialty of intensive care unit. Secondly, productions of a range of new intermittent pressure ventilation. And lastly, the development of polio vaccines. That is all from us.
Thank you!